Our relationship with Delta Dental is changing in the new year. What that means to you and your family is you'll still be able to use your dental insurance here. It'll just work a little differently. But what won't be different is the quality of care you will receive. This change will allow us to continue to provide the absolute best dentistry for you and your family and continue to build the relationships we already have.
Insurance companies are placing more and more restrictions on in-network providers and how they care for their patients. We don't want to be in a position where we have to cut any corners in the quality of care that we provide for you and your family. The amazing thing about your Delta plan is that you get to choose your provider. We will still file a claim, and our amazing team is going to help make sure that you get paid in a timely manner.
We look forward to seeing you in our chair and being your wellness partner in your dental health.
With these changes, we're getting a lot of questions about whether or not we're still going to be taking your insurance, and the answer is absolutely yes. Most of our patients that come here come uninsured or out of network anyway, so we are very fluent in helping answer any financial concerns you might have.
We have a lot of out-of-network patients who are able to use their benefits here without any trouble.
When we first started practicing here, we were able to fluently work with insurance companies to provide all of your needs, and over time that has changed.
We want to spend time with our patients. We want to get to know our patients, form relationships with them. We don't want it to be rushed through.
And we don't want to have any barriers in providing best optimal health for our patients. We want to talk to them about their health needs, not just their oral health needs. Insurance companies are replacing a lot of restrictions on how we can address inflammation and gum disease, and we don't find that responsible for taking care of our oral health care needs. That's going to differ from patient to patient, and we're going to help answer that for each patient as the question comes up.
We will always try to give you our best estimate of your out-of-pocket expense. However, as with most insurances, we can never be 100% sure.
And it may be a little bit more for you to come here now, but we believe that the quality of care that we offer vastly outweighs that, so we'll look forward to continue taking care of you. You will see some changes with your out-of-pocket. One of the nuances of how we're going to be customizing care with the new relationship we have with Delta Dental is that you will be responsible for your dentistry at the time of treatment, and then we help facilitate making sure that Delta pays you within the 30 days that they're required to do so.
We've seen this happen with other insurance companies where they send the check directly to the patient.
We're not honestly sure why, but we do feel like it is just one added barrier to good patient care. Insurance companies, in efforts to save more money, are creating more restrictions and barriers for their clients, and the result of that is trying to drive people to in-network offices. We get that change can be scary, especially when finances are on the table. Our team is going to handhold all the way from start to finish to help facilitate everything that you need us to keep this as easy as possible. And we know this is the right place for you. We want to keep you here, and just know that we're going to do everything that we can to make this the easiest transition possible for you. We accept all insurances and file them for you as a courtesy from our office, and also help facilitate making sure that you get reimbursed for everything that you need to. Insurance has a lot of complicated nuances, and anything that we can do to help support good health and take some of the load off of you after you leave our office is what we aim to do.
Yes, we have a lot of patients who come to us out of network, and they're able to use their benefits without any trouble.
Most of our patients are uninsured or out of network, and we help facilitate all financial concerns and putting in any plans into place to help them get their best dental care. If you go to an in-network dentist, it may in fact be a little cheaper for you. However, the quality of care may be compromised, and you're not going to have the amazing team that we have built for you. You're not going to have all of the extra care that we pour into our time with you.
They feel like family, and we want to always make people know that we care about them and we care about the relationships that we've been building over the years.
And in the past, when people have left, they've come back and just said, I felt like a number elsewhere. I want to have the quality of care that y'all offer here, but also to have the environment that you provide.
We have an amazing team, and they care for the patients just as much as we do.
This was not a financial decision for us. This was more about the quality of care that we can provide. We have just built such amazing relationships with the families that we have here, and we did not enter into this decision lightly. This is a very big change for our office and for our patients.
We've thought a lot about this. We made this decision for the patients so that we could spend the quality time with them that they deserve, so we can provide the dentistry that they deserve, so we don't have to cut corners at their expense. We made this decision because we want to be able to treat our patients with the best care possible.